Professor Lee Fay Low. She's well known to many of us. Lee Fay's got a long-standing interest in dementia and aging, looking at home care and residential care, looking at practice and culture change, rehabilitation. And she's particularly interested in seeing how knowledge can be translated, and both through epidemiology, systematic reviews, and cluster randomized control trials. Lee Fay is going to tell us how has the COVID-19 pandemic affected people with dementia. Thanks, Lee Fay. Thanks very much.
Thanks, Clement. So continuing, I guess, the theme of COVID that Kerry Chant started and was also touched on in Marie's talk, I'm going to very rapidly tell you a little bit about how COVID-19 has affected people with dementia. So you know that the pandemic's still going on, and it's been a really interesting time as a researcher trying to stay on top of what's happening and considering, how fast to publish. I'll comment a little bit about that. So overview that I'm going to talk about COVID and on people with dementia and mortality risk, the risk of dementia, talk about behavior. We've seen increase of behaviors and antipsychotic use, and the negative impacts and well-being of people who live at home, in nursing homes, and of visitor restrictions. So a recent systematic review of 8 studies shows that if you have COVID and you have dementia, dementia increases your risks significantly, so with an odds ratio of 3.75, and that's after controlling for age, which we know is also a risk factor for mortality. So basically, dementia actually is a massive risk for dying if you have COVID. I think Matthew already mentioned this morning, but we're starting to see more and more evidence about the neurological impacts of COVID. Just a few example studies there, but I guess as a dementia risk researcher, we're kind of wondering if eventually people who have COVID-19 will be at increased risk of dementia. We're particularly, I guess, interested in groups we already know are at risk of dementia. So this, for example, is a study of people with MCI in Italy during COVID, shows that their lifestyle behaviors, basically the healthy lifestyle behaviors which are preventative of dementia, decrease. So they, so are they at increased risk of dementia? And while we won't have data for everywhere, it's certainly a reasonable kind of hypothesis that people at risk of dementia might be at increased risk because of the restrictions that have been put in place. Here's data from the English Registry, which is the blue bars in the middle. The data is from 2018, 2019, and 2020. So 2018 are the 6 dots on the left, 2019 the middle dots, and 2020 the right-hand dots. The blue dots are the antipsychotic prescriptions, showing an increase in antipsychotic prescriptions for people with dementia this year around the time of the pandemic, which is very worrisome. It's only about 5% overall, but still significant. And also the orange dots, which are the number of people on the UK, the English Dementia Register, showing the decrease in the number of people on the register. Basically, no new people aren't going on the register because we know that the rates of dementia diagnosis have gone down this year in England, and we suspect in Australia as well. We did an add-on study to the Cognizant study, which is on post-diagnostic support with dementia, where we talked to some people living with dementia, and we did tacked on, to our focus groups and interviews with health and social care professionals. The people with dementia and carers we actually talked to twice. So once as social restrictions were easing, and then the second time they were eased in some states, but actually worse in Victoria. That was quite interesting. And Pauline Beard, our honour student, did this data collection. I guess the major impact was that lots of services were cancelled for people with dementia, including memory clinics. And this caused lots of disruptions to the professionals we talked to, and the challenge, I guess, of the shift to telehealth. So, as you know, many older people are great with technology and embraced Zoom and technology during this time, but many people we had to talk to or had to be assessed or be provided services to by phone. And some people with dementia just, couldn't use the technology. It was very difficult. So COVID's had a great impact, I guess, on many dementia services, both health and social services. Everyone experienced changes to lifestyle, so that's not surprising. But on top of that, I think it affected people with dementia and carers because some of them at least felt that they only had so much time left, to live well, and that the time was passing, that they couldn't see their grandchildren while they still could enjoy it. They couldn't go on holidays while they could enjoy it. And certainly people with dementia who were experiencing loss, this was one more bit of loss that was happening to them. So I guess unlike Mary talking about the pandemic affecting younger people in the, because they can't go out and socialize with their friends, a lot of people with dementia were telling us that they were quite socially isolated already. So while it did change their routine, it wasn't significant that way, but it certainly affected, I guess, how they saw life and stopping them being able to live life while they still could. There was the social isolation, there was technology, and then the stress and anxiety. And there was some particular stress and anxiety themes, I guess, that came out around living with dementia. So carers were really worried about helping the person with dementia understand the rules, reminding them of the rules, stopping them from doing something wrong. So that was an extra burden, I guess. And carers were additionally stressed because they were taking on much more of the caring responsibilities because the services weren't there. Particularly in the people in Victoria we talked to, they really felt in the second wave that they were a prisoner in their own home, and that, in comparison to people in the other cities who, in the other regions, including people in the country actually, that things were going back to normal. But some people also said that they got used to the restrictions. So our results are very consistent with this report that Yunhee helped, Yunhee John from our university helped Dementia Australia produce, that people were feeling lonely, frustrated, stressed and tired, that the stress and anxiety increased. There were really limited availability of services, and they were concerned about the quality of care of their loved ones, particularly in residential care. And I'm going to talk a bit about residential care now. So this work, I guess, has been really interesting. I've been working with a group called LTC COVID, where we've been doing rapid reviews and posting them online around the situation, the policy responses to COVID in different countries. We've updated the Australian report 3 times now. Most latest, Sarah Charlesworth did the update in October. And in Australia, we've had 2,000 infections in nursing home residents. 33% of those died, but that actually represents 75% of all COVID deaths in Australia. We estimate that between the 50 to 70% of those residents who passed had dementia, but we don't actually have data on that. To compare, I guess, how Australia is going in terms of COVID deaths in nursing homes, our numbers, which is the red dot here, which I just updated because this graph is a bit old, shows that that proportionately the number of COVID deaths in nursing homes is very high in our country. So we did particularly badly, I think, in terms of preventing COVID outbreaks or managing it. Or maybe we did really well in the community otherwise, but not well in nursing homes. This is a Dutch survey of residents, relatives, and professionals in many nursing homes. And it essentially shows that during this COVID period, that in facilities, there was an increase in negative behaviors and emotions. And I already showed you, I guess, the antipsychotic data use, and I didn't put it in, but there's certainly data from Canada showing increased use of antipsychotics in Canada, and I would suspect in Australia, but we haven't seen those data. So this is a review that we've been working on in terms of international guidelines for visitors in nursing homes. So all nursing homes pretty much locked down visitors from about March onwards. In Australia, our guidelines, our federal guidelines, had visitor restrictions, so people were still allowed to have visitors only 2 a day, and only for so long. However, almost all nursing homes in Australia went beyond that and locked down facilities against visitors. So we know that in Melbourne, that people basically between March and October, November, didn't see their families at all, except using Zoom visits or phone visits, if that was possible. So if you review the international evidence, there's strong evidence that basically these visitor restrictions had very negative impacts on the well-being and behaviour of residents and families. We know that it made a lot more work for staff and probably reduced quality of care, so there's not as good evidence on the quality of care, because family visitors were doing a lot of essential care. So there was the husband or wife who'd go in and feed their spouse every day. There were the children who were coming in and helping mum get dressed and groom and keep them calm and kind of manage their stress level. So we know that staff had to do all that because family visitors were going. We also know that the guidelines that came out were mostly silent on residents' rights and residents' well-being. But interestingly, I guess, the responsibility to open safely to visitors, again, were left to individual facilities. So countries or regions, often regions would say, okay, now you can have visitors, but you have to meet all these criteria. So you have to have PPE, you have to have safe visiting procedures. You have to judge that in your area, the COVID levels are low enough, whatever that means. And so what we've seen in Australia and in other countries is that facilities have tended to be risk averse and not opened to visitors, even though the law says that now they can, the public health law says that they can. There's only been one study around safe visiting. It was done in the Netherlands as part of their national reopening strategy, and it found that if you followed safe visiting guidelines, there was no increased risk of COVID in nursing homes. And what we know is that there's been almost no kind of regulation around well-being and visitors. So, for example, our regulator in Australia used to interview people with dementia about their experience of quality of care during their accreditation visits, but those have stopped since COVID and haven't started again. And some of the accreditation visits were stopped during complete lockdowns as well. So it's I guess, worrisome. This is some data from a selected number of regions showing when visitor restrictions were put in and when they were reopened, and the prevalence of COVID in that region, basically, at the time. And I've just highlighted that in Australia, we've been particularly averse we've been particularly quick to shut and slow to allow reopening based on COVID in the community. And I guess that reflects our public health response, which has been quick in terms of putting in lockdowns. And I'm not arguing about it being right or wrong, but that this has, and just pointing out that this has an impact on residents, that they really can't see their loved ones for extended periods of time because we have been risk averse. And I guess the balance on well-being, particularly as we know that for some residents at least, they can't use Zoom or phone. It doesn't make sense to them. It upsets them and confuses them. And for many facilities, they don't actually have the staff support or the technology to do, a lot of televisits very well. The stuff that I'm saying is be very consistent in the Royal Commission around visitor restrictions having a negative impact, how important physical visits are that can't be wholly replaced by technology, and also a call, I guess, that there should be funding to support staff to allow them to have safe visits. So we've been talking to very stressed facilities who had to put on extra staff to do the visitor check-in, to make sure that they're safe visiting, to bring the family and the resident to the place and to sanitize afterwards. So it actually increases staff workload to not have visitors doing essential care, and increases staff workload to facilitate safe visits. our international group is going to recommend that complete visitor bans should only be a last resort public health policy, and that they should be putting in other policies and practices which the extended group have shown have more evidence for minimizing risks, including single site work policies, in fact, better infection control training and PPE, and that we should be using safe on-site visiting practices, and nursing homes should get funding to do this. And we should be thinking about how regulators are making sure that resident well-being is upheld. So just to finish quickly, I've been working over the years with a group of engagement specialists who visit residents in care homes, and that this improves well-being and decreases behaviors, and they couldn't go in. So they invented this new type of visits called window visits, and we've written up in a little local journal. But it's been, I guess, one way that we've managed to connect with residents and kind of provide this psychosocial group support through COVID, including we experimented with Zoom visits and we figured out how to do those. There were lots of interesting logistical challenges. So thank you for having me, and it's kind of an ongoing piece of work trying to mitigate the impacts of COVID on people with dementia.